and so many other organizations, locally and internationally, so that resources are put together to give that particular needed response to the fight against COVID-19. We're also going to talk to Dr. Victor Miti, who is the president for the Society of Medical Doctors in Malawi. He is a healthcare and, of course, a healthcare worker, a frontline healthcare worker, and also a board member of this particular private citizens COVID-19 response. We want to hear from them the state of affairs in relation to this particular fight against COVID-19 in Malawi. We want to hear how ready the country has been after the first experience of the COVID-19 pandemic. My name is Chawezi Banda. Once again, I hope you'll be there to have a feel of what this particular initiative is all about. What was the motivation behind the establishment of this particular initiative, and how have the interventions been so far to this particular moment? Let's start the program by introducing our guests in this particular program. I should start with Dr. Hara, who is the deputy lead organizer for the COVID Response Private Citizens Initiative. She is speaking from the United Kingdom. Dr. Hara, welcome to this particular program.
Thank you very much, Chawezi.
Thank you. Again, we have got Dr. Miti, Dr. Victor Miti, who is the president for the Society of Medical Doctors in Malawi. He is speaking from Lilongwe. Dr. Miti, welcome to this particular program.
Thank you very much for having me in this program.
Thank you very much, Dr. Miti. First things first, let's set the scene. I want us to understand the state of affairs in terms of the fight against COVID-19 in Malawi. Dr. Miti, fill us in terms of this particular state of affairs when it comes to the issue of the fight against COVID-19 in Malawi, speaking from the perspective of Society of Medical Doctors in Malawi.
Well, thank you very much. I would say, without hiding weight, that we're in a state of crisis. Right now, what is happening in the healthcare, in the hospitals, is indeed a disaster. You have seen that we've seen a lot of cases coming in since the beginning of January. We have lost a lot of people due to COVID-19. It has affected the politicians, the pastors, young, old, almost everyone knows someone who has died of COVID-19. In the hospital, we are challenged. We don't have resources to take care of it. We don't have the equipment to sustain the healthcare system. So in short, we're in a state of crisis. Our hospitals are screaming. People are dying, and yet we're seeing more cases coming in. So this is where we are. And for us to move forward, we can only achieve that if we all come together and fight to win this battle. We can't leave this initiative in the hands of government. Yeah, we can't leave this in the hands of government alone. We all have to come together.
All right, Dr. Miti, I want to understand a few things before we get to Dr. Hara, who is representing this particular COVID Response Private Citizens Initiative. I want us to understand what was our state of preparedness after the first so-called wave of the COVID-19 pandemic. We understand we are in the second wave. Some are calling it the second wave. Others are saying, no, this is not necessarily a second wave, but it is a totally different variant of the pandemic. We want to understand, after the first experience, coming to the second, this particular, the new wave or the new variant of the pandemic, what was our state of preparedness? Did we think perhaps the virus was gone? Were we prepared in terms of preparation of the personnel, the medical personnel, the infrastructure, equipment needed after we had had that particular experience? Where were we in terms of the state of preparedness in terms of this particular virus? Dr. Miti. We seem to be having problems there. All right, let me get to Dr. Hara quickly. Dr. Hara, we have heard it from Dr. Miti there, the president for the Society of Medical Doctors in Malawi. He's saying we are in a state of crisis, and certainly there is need for so many hands to be on deck for this response to be effective and to cover so many parts of the country in relation to the fight against COVID-19 in Malawi. What was the motivation behind the establishment of the Private Citizens COVID-19 Response Initiative? What motivated you? I understand you are the deputy lead organizer, and we should believe the one who is taking the overall lead is Mr. Onjezani Kenan. As private citizens, what was the motivation behind all this particular initiative? Dr. Hara.
Yeah, thank you. To begin with, this response is a response amidst a pandemic. It's a response to an emergency. So it's not like we sat down and we said, well, let's do this and let's get motivated to do this, that, and the other. Actually, this was a response to a raging crisis. So, but if you have followed, the person that Onjezani is, and if you have been following what I do on my Facebook page, we are both individuals that have been raising funds for various causes. So, we raise funds for students, we raise funds for people who are struggling for one thing or the other. So this is something that we've been doing at micro level up until this point. So what led to this was that there was a guy about 2 weeks ago, I think, unfortunately, got COVID, and he put up an SOS on his Facebook page to say, he was in hospital and there wasn't enough oxygen, there wasn't enough flow meters, and he was asking people to help. So that got Onjezani thinking that actually, this is a crisis. We need to do something about this. So he put out a call asking people that, can we do something to help? And then I jumped in. And to be honest with you, when we started this, we weren't really thinking about the levels that we've got to. We were only thinking a few thousand, 100,000 pounds, kwachas. And then, before we knew it, it was 8 million, 10 million, 15, 20, and then it's gone all the way to 113 million. So we didn't really plan for this thing to be this big at all. This is something that has actually ballooned on us, something that has grown whilst we've been trying to manage it. So part of this, yes, is conscious thinking that we need to jump in and do something. But part of it is something that I think eventually is what Malawians have decided they want to do, which is jump in and help.
All right. From what I'm getting from you, it seems you are overwhelmed by the support and the response that the public has given to your initiative. Clearly, you're saying you did expect this particular magnitude in terms of the response. So far, perhaps, when matters of this particular nature happen, what people call for is an issue to do with transparency and accountability. How do you ensure that the funds which have been entrusted in your hands through this particular initiative are accounted for penny by penny to make sure that people do continue having trust in you with their money, so that the response which is being called for should be indeed the one which this money is put to?
Yeah. So if you followed what we've done so far, what we have done so far is literally to be very transparent in terms of how much money we're receiving, so giving people updates. So we've been giving people updates right from the first million up to the 113th million, which is where we're at now. At the same time, we've also been giving people feedback about what we're spending. So we've spent about 33.8 million so far buying, oxygen cylinders and flow meters and some essential medicines. And we are just about to go and make a second purchase. And all that, we're putting out the invoices, the payments, amounts being moved from one bank account to the next. So I think that we totally understand that people need to ask these questions about how accountable are you going to be as private citizens, particularly because some of this money went to my private bank account and some of this money went to Onjezani's private bank account. But all that is a reflection of the emergency nature of the situation. Given what we're going through, we didn't have time to say, let's sort out a bank account and let's create a trust and let's do this, that, and the other. It was literally jump in and do something. And that's exactly what has allowed us to, at this point, be saying we've already delivered some of this stuff to some hospitals, and we're in the middle of ordering more supplies. But actually, we ask people to continue to trust us, and we give people assurance that whatever we do, every single penny is going to be spent on the cause that they have put their money on, which is the COVID cause. So we will do our very best. I mean, we will have independent auditors come back in and audit my personal account and audit Onjezani's account and tally that up with what we've spent and go back to Malawians and tell them what their money has done.
All right, before we take a short break, I just want to understand, we know and we hear that you have established a board or a committee of some sort to look after these funds and, of course, to be running up and down to make sure that they source the things or the things that are needed for the response, which is being, which is the one that perhaps everyone is looking for, to make sure that all the money that you are collecting from the citizens and, of course, from institutions, public and private, is indeed the response that is required. I just want to understand, this particular board comprises who and who? Who is this particular board?
So in this board, there's myself, there's Dr. Victor Miti, who's the other person on the show. There's Nkhani, and then we've also got Pole Sana Tembo, and we've also got Masanko Stable Mbizi. So these are the 5 people that are working very hard behind the scenes to do the things that we're doing. And we have up-to-date opened official bank accounts, and those bank accounts are bank accounts that no single person can actually make transactions. We need at least 2 or 3 people to authorize payments. So at the same time as trying to implement what people are asking us to do, we're also trying to put in place measures that means that we are actually more transparent and accountable, and people can keep having faith in what we're doing.
We understand that you have been in close consultation with the Society of Medical Doctors for them to be able to give you a list of the things that are required the most in terms of this particular response. What are some of the things that you have done so far, and what are the gaps that remain to be filled so that the response is quite comprehensive and is that which is indeed effective when it comes to the COVID-19 pandemic?
Dr. Miti, do you want to talk about that?
Yeah, it's indeed true that, yes, it is indeed true that we are working hand in hand, myself as the president of the Society of Medical Doctors, at the same time, indeed, as the board member of this initiative. Our working relation so far is based on the fact that we need to help our people as fast as we can, and we need to have the greatest impact with the little resources that we have acquired. I wish to testify indeed what Atandi has just said, that so far we have indeed bought some of the materials, and some of these materials have already been donated. And I personally am the one who donated these things, for instance, at Kamu Central Hospital. So we have bought 40 cylinders, and there are other items that we are buying, and we're working into a lot of logistical issues. So basically what the Society of Medical Doctors is doing is what we call the need assessment. So my society is busy right now looking to all the hospitals in Malawi and making necessary communications with the leaders in these hospitals, understanding what is going on there, so that as more money is coming in, then we can already know what our people need so that we can save lives. We know that most of the hospitals, they depend on the government, but you and I, we can agree that sometimes it takes a lot of channels for government to facilitate the availability of these resources. But we know that these resources are needed as early as yesterday. That's why now this initiative and the society, we're coming together to say, oh, at Nsanje District Hospital, they need an oxygen cylinder. Maybe it will take 2 weeks for the government to procure that, but people are dying because that cylinder is not there. So what we're doing then is the society, together with this initiative, we're able to identify where we can find a cylinder as fast as possible, pay for it, and take it to where it is needed within the shortest period of time. So this is the basis of our working relation, and we're very happy with this, because our common goal is to make sure that no Malawian should die simply because there's no life-saving material in the hospital.
All right, Dr. Miti and Dr. Hara, we take a short break of about a minute. We'll be right back with our discussion so that people understand more in relation to the funds that they are pulling together to save lives and, of course, to make sure that there's a bit of normalcy in terms of the things that are required in our hospitals. A short break, please, of about a minute, and then we'll be right back with our discussion. Welcome back to our special program in which we are talking to Dr. Thandi Hara, who is the Deputy Lead Organizer for the COVID Response Private Citizens Initiative. We are also having in this special program Dr. Victor Miti, who is the President for the Society of Medical Doctors in Malawi. He also happens to be a frontline healthcare worker and the board member of the Private Citizens COVID-19 Response Initiative. Welcome back, our panelists, Dr. Hara and, of course, Dr. Miti.
Thank you very much.
Thank you.
Thank you very much. Welcome. I want to get now to Dr. Miti. Dr. Miti, we understand that apart from the interventions that are being done to the COVID-19 response, people are also being encouraged to go to hospital whenever they don't feel well or whenever they trace some symptoms of this particular COVID-19, which is perhaps ravaging and, of course, leaving so many people hopeless and, of course, fearful of this particular pandemic. We want to understand what is the support that the people who are infected are getting in the holding centers or in the hospitals which they are being admitted to. We want to understand what is the support or the help which these people are receiving in these particular respective places where they are being kept.
Yeah, it is indeed true that we advocate that when someone is having symptoms of COVID-19, the best place to find themselves is in the hospital. And the reason why we advocate for that is that the earlier we diagnose someone with COVID-19, the better. It is easier to save a life when the disease is found in the early stage as opposed to a later stage. When these people are within our hospitals, so first of all, we have the team, the lab team that is charged with testing them. So they will be directed where the testing takes place, and upon reaching that particular area, it will be explained to them as to what the test will involve. And once the test has happened, then there's a process in which the results are being disclosed to them. I want to make it clear that we know at this moment that we're overwhelmed as the healthcare system. And sometimes patients might wait a little bit longer before they get tested, or they might even wait a little bit longer before they hear their results. And this is not the making of the healthcare workers, but it is the demand of the situation. So if someone is facing such challenges, they need to also understand that we are facing something that we have never faced something like this before in the healthcare system. So our approach might not be to the satisfactory of everyone, but we all have to come together and understand that this is how things are supposed to be. Where we need to improve, we can all work together to improve that element. But as citizens, they need to take also the responsibility of making themselves available as fast as possible to the hospital, because by doing so, they are actually saving their own life. They're not making a favor to a doctor, to a nurse, or to a lab scientist, but they're doing a favor to themselves, their neighbors, and their loved ones.
Dr. Miti, before I get to Dr. Hara, I want to come in with this question. Pandemics of this magnitude have the habit of exposing health system in so many countries that perhaps they get themselves to. How much has our health system been exposed by this COVID-19 pandemic, starting from the first one to this particular second wave?
Our healthcare system has been rendered naked by this pandemic, and there are no questions about it. We have been operating from the level of insufficiency throughout the establishment of our country. And now with the coming in of the pandemic, we have been hurt very, it has hit us very hard simply because all the challenges that were masked before, they're now being exposed. We talk of issues of infrastructural development. We're using the hospitals that were built by Kamuzu in 70s. And these hospitals have never been expanded. Now, when the pandemic came in, we already saw the issue of shortage of space where we can put our patients. We're also talking of issues of, internal equipment within the hospital. So by now, we wouldn't be struggling with oxygen cylinders, but this has been the case. You're talking of the issue of the healthcare workers. It doesn't make sense to be calling for employment of healthcare workers when the pandemic is in your midst, while these people have been sitting at their homes many, many ages without job. And yet we know that our healthcare, they are insufficient in the government. So you can see that at all levels.
How best, Dr. Miti, how best could we have handled this case with the experience of the first wave that we had in Malawi? How best could we have handled this case?
So first of all, I think the faults in as far as how this pandemic has been handled are at both levels. By both levels, what I mean is at community level, then at the government level, and even at the hospital level. At community level, we have seen that people didn't take the message of COVID-19 seriously. I remember I was in the newspapers by November, whereby I was addressing the nation to say, we can see what is happening in South Africa, what is happening in the UK. The second wave is coming in Malawi. But people thought we were joking. We saw people doing the parties during Christmas. We saw musicians organizing some concerts. And when the government tried to put in some measures, we saw some musicians going to court, getting an injunction just to save their own means and ends. And then when January came, it was a disaster. At the hospital structure, we could have reigned from the first wave, and we would have had a very good planning structure to say, let's have many oxygen cylinders. Let's already be preparing like a field hospital or like an infectious disease center within all the regions. And then even at the government level, they would have taken some bold specific measures to make sure that no one is entertained when they are violating the COVID-19 measures. But we've seen the government moving back and forth. We've seen the communities not, even right now as people are dying. If you go into the markets, if you go somewhere there, you still see that people think COVID-19 is just a hearsay and these are just jokes, but people are dying and the hospital is collapsing. So these are the areas where I feel like we could have done better, and we need to do better if we're to save our future.
And I think, can I just add as well?
Yes, please.
Yeah, can I just add
maybe
there?
before you... Yes, please, come in.
Yes, I was just going to add that, right now, because of where we're at, it looks as if our health system has been exposed. I don't think it's been exposed. We've just been living in denial about the health system that we've had all these years. If you are sort of serious and objective, even 3 years ago, our health system was nothing to talk about. The system has been serving a particular kind of Malawian, that is the poor Malawian that can't afford to pay for anything. Those Malawians have been dying in these hospitals for years. And Malawians like us who have got money, who can afford to go to the private hospitals, just didn't really care. Now, this pandemic has forced every kind of Malawian to go to government hospitals. What we see there, we don't like. We think the pandemic has exposed it. I think we've been in denial for too long, far too long. We have had many, many years of not caring about public health service. We should have seen this coming 10, 15 years ago.
All right. The question that follows to you, Dr. Thandi Hara, is that in as much as you're making efforts and you're doing a pretty much good job to mobilize resources so that we package a response to this particular COVID-19 pandemic, I want to understand what are the lessons that we can draw from the first and the second so-called wave of this particular pandemic, and the lessons that perhaps we can draw from outside. You are a Malawian working in the diaspora, in the UK for that particular matter. How have they been able to handle, and what is the magnitude of impact in terms of this particular COVID-19 pandemic, and how best can Malawians draw these lessons from this particular pandemic, which has so-called left us kind of naked?
So in terms of lessons that can be learned from the first and the second wave, the UK, the US aren't the places to learn lessons from. They also did not do it right. They took steps way too late. People didn't take messages seriously. The government kept going backwards and forwards about what it was asking people to do. It was all pretty disorganized. But if you look at countries like New Zealand, they did things very quickly, very fast. As soon as they heard of COVID-19, they shut the country down. They asked people to stay home. They did all the basic public health sort of interventions, test, treat, track people, isolate people, quarantine, all those things right from the beginning. And actually, at some point, they did manage to declare themselves COVID-free. So if there's any country we need to be learning about, or we need to be learning from, it's countries like New Zealand. The countries that took the right measures very, very early on are doing very, very well. And those measures are very, very simple for people to understand. But people just don't seem to be willing to give up their rights. People just don't seem to be willing to put in a mask, or to stop moving around, or to stop going to funerals, going to churches, going to all, parties, pubs, and all those places. And I'm afraid the virus actually wants people to be exactly where they are right now, which is not wanting to take any measures whatsoever.
Time doesn't seem to be in our favor. Dr. Hara, I want to ask you one last question. I want to give you an opportunity. You earlier on indicated that when you came up with this particular initiative, you never expected a response of this magnitude, and you seem so quite overwhelmed that Malawians and of course so many other institutions and private individuals have responded positively to the initiative that you set up. What is the word that you have to them? And again, a word of assurance that their money is in safe hands and that the money will be put to good use to make sure that the response which was called for is packaged in a way that will make a difference when it comes to the COVID-19 pandemic.
Yeah, I mean, I have to say that totally what you've just said there, we are totally overwhelmed by how Malawians have responded to this. When we started this initiative, we were literally looking at a few millions, but it's grown on us, it's ballooned on us, and that is testament to how willing Malawians are to actually jump in and make a difference. So that response for me actually speaks a lot. This thing, although people keep saying, oh, you guys are doing a fantastic job and you organizers are really, quite committed and all this, the rest of it. Actually, I think this is about Malawians. It's not about us. We are simply doing what Malawians have asked us to do. We simply happen to be the people that were there first to suggest it, and the people that were there to say this is how we can do it. But actually, this is what Malawians want. And I think that it's really, really important that in the excitement of what has happened, people don't forget the people that have given and what they've done. And this includes really people who gave their last pennies. Those are the real heroes of this story. And because of that reason, we are holding money in bank accounts, money that has come from children, money that has come from people who've lost their loved ones, money that have come from people who have dug deep into their pockets. For those reasons, we are people of values. We will assure Malawians that every single penny is going to go down on the ground to save lives. We will be very accountable. We'll have all the accounts audited and we'll report to everyone about what we've done.
In a matter of 30 seconds, Dr. Hara, this pandemic seems to be with us, at least in the foreseeable future. How best do you promise to hold on to this particular initiative? Are you not going to get tired along the way and stop everything that you're going to do? 30 seconds, please. Respond to this particular question.
No. We are not going to let Malawians down at all. If there's work to be done, if Malawians want us to carry on doing it, we're here. And we're sort of assuring everyone that this pandemic is here for a long time and we're here for the long haul. We're here to make sure that we save as many lives as we can in the shortest possible time.
All right, let me get to Dr. Miti for him perhaps to wrap up our program because time doesn't seem to be on our side. Dr. Miti, just a word of encouragement and a word of hope to Malawians. Do people who find themselves to be infected with this particular COVID-19 stand any chance of survival when it comes to the measures and, of course, the support and the help that they are getting in the hospitals? Is there any chance in percentage terms of survival once a human being is infected with this particular COVID-19 virus?
To fellow Malawians, there is good news in the land. The diagnosis of COVID-19 does not mean that it is a death sentence to you. Now, about 90% of our patients, they get cured from COVID-19. You can see that we have had over 17,000 people that have catched this disease. But those that have died, they are around 500 something. The only thing that you need to do so that you shouldn't be in the group of the less 10% that die of the disease is to make sure that as long as you have the symptoms, you rush to the hospital, you meet the doctors, and they help you. In doing so, you're saving your life and you're also protecting the life of your loved ones. As the healthcare workers, we will continue to save this nation. Regardless of the challenges that we're facing, we will put it upon ourselves based on the oath that we took, that we will do that which is good for our people. For those that are contributing, we thank you. And we know that you are doing that, not that your money should be squandered, but that life that could have gone without your support, that it should be saved. And we're here to do that, and we will do that.
All right, my last question to you, Dr. Miti. We are hearing of a so-called wonder drug, which is called ivermectin. This is a drug which some people say is performing wonders in Macedonia, in Australia, in some parts of Brazil, and some parts of South America. They seem to be using this particular drug called ivermectin. Is there anything, any attention being paid to this particular drug in Malawi so that we save lives and we prevent others from catching this particular COVID-19?
It is indeed true that there's news all over the world talking about this drug. It's not necessarily a wonder drug. It's a drug that we know we've been using it for quite a number of years. It's just shown that now there's a little bit of efficacy of it towards COVID-19. We're still reviewing the papers, and once we have gathered enough evidence, I think it will be okay for us to start using it in our land. So to all the people that are looking at this news, we're taking it seriously and we know what we're doing. Once we have seen that there's enough evidence, then we will use the drug. I just want to take this opportunity also to advise the people that it is always dangerous to just go to a pharmacy and buy a drug, because some of these drugs are contraindicated into some of the people. And if you have conditions that can make you develop adverse event from this drug and you just take it, then it will be a disaster for you. Wait and believe in the healthcare system. Once we have enough evidence, we will be able to use it as we have been able to use other drugs that have proven to be effective in this disease.
All right, Dr. Victor Miti, President of the Society of Medical Doctors and, of course, a frontline healthcare worker and board member of the Private Citizens COVID-19 Response. Thank you very much for taking time to talk to us in our special program in which we dwell deeper in matters to do with the COVID-19 response and other interventions. I should also thank Dr. Hara. She is the Deputy Lead Organizer for the COVID Response Private Citizens initiative. She's playing a trade in the United Kingdom. She was here also talking to us and, of course, sharing with us some of the things that are doing in terms of the initiative and, of course, the interventions that they are doing to make sure that Malawi is saved in respect of the COVID-19 pandemic, which has ravaged societies and left so many homes crying and, of course, sobbing. My name is Chawezi Banda. I just thank you so very much for taking time to watch this particular program, which we felt quite important to talk to the President of the Society of Medical Doctors in Malawi, and, of course, Dr. Thandi Hara, who is the Deputy Lead Organizer. We understand that this initiative is one that is coming up with trying to source resources together so that at least the things that are required in the hospitals can be found. They are talking about the so many things, the equipment, the medical supplies, and all sorts of things that are required in the various hospitals in the country so that lives are saved when it comes to this particular pandemic. My name is Chawezi Banda. Thank you so very much, and we ask you to be there again next time when we come with yet other guests to discuss some other matters that pertain to our day-to-day lives here in Malawi. Thank you very much, and keep watching Mibawa and enjoy the rest of our programs.